You're listening to the Heart of Giving podcast with Art Taylor, powered by BVBGive.org. Here we explore the motivations that form the basis of giving and service. We inspire generosity and celebrate the transformative effects that giving and service have on the human spirit and on community. The conversations featured on the podcast also uncover giving strategies that educate and provide tools to help listeners make impactful gifts of both their time and money. We hope you enjoy this episode.
This is the Heart of Giving podcast, powered by BVBGive.org. Give.org is the nation's standards-based charity evaluator and your one-stop source for information on giving and reports on the most asked about charities. I'm Art Taylor. Today, my guest is Amanda Missey, who is the CEO of the Bergen Volunteer Medical Initiative. And this organization actually provides free health care to people who can't afford it. That's right, free health care to people who don't have medical insurance. And I have to tell you, it's remarkable what they've been able to do. For instance, 1,001 patients served, 9,595 patient visits, 64.6% of patients with diabetes have controlled blood sugar, which exceeds the national benchmark of 34.7%. People with hypertension that they've seen have controlled blood pressure at a rate of 63.5% compared to 60.9%. Women patients 40 and over have received 72% of the mammograms that they're supposed to receive compared to a national benchmark of 51%. And over the course of its existence, since 2009, they've seen 4,093 unique patients since that time. It's remarkable what this organization is able to do to help patients who don't have insurance. And so I thought it was really important to bring Amanda on to learn about how they go about this and whether there are models that they can share about how other communities can do this. And more importantly, what they're planning to do to expand. So Amanda, welcome to the Heart of Giving podcast. Amanda, welcome to the Heart of Giving podcast.
Well, thank you. Glad to be here.
Well, Amanda, I just reeled off some stats from your website about the quality and the intensity of the services that you all offer people who don't have insurance. And I am just blown away. And I'm curious, really, how you're able to do this with the relatively modest resources that you have. What is it about your organization that is able to deliver in this way for people in your community?
Well, if you look at our mission statement, the very first words are powered by volunteers. And that really is the way that we're able to achieve what we achieve on a relatively modest budget. You're right. We're saving the system thousands, maybe millions of dollars. But the reason we're able to do that is because we've got volunteers working for us.
Yeah. How long have you been doing this?
Oh, some days it feels like 100 years, but actually I just celebrated my 10th anniversary.
Wow. Okay. So you've been at it for a while.
I
And
have.
have you seen the needs increase or decrease over that time?
I think the relative number of people has stayed kind of constant, which is really sad. But what we're seeing now is that the needs have gotten progressively more complex. So in response, we have increased the number of services that we provide to our patients.
In what way? Say more about that.
So when I got here 10 years ago, we had 13 employees. We probably had about 75 volunteers, and our budget was around $900,000. And we had about 900 patients, which is not an awful lot less than we have right now. we fast forward 10 years, our budget's more like 2.8 million. We have 38 staff and we've got about 160 volunteers. What has happened in that 10 years is that we moved from a primary care clinic that really provided basic primary care. We did women's health. Uh, we did women's health, and that was kind of it. And now we still provide primary care. We still do women's health, but we also are providing mental health support. We have a very robust case management program. And then we have a number of programs that address chronic disease. We've got 15 specialists or specialties, I guess I should say, here in our office. So we are providing a really wide array of services. So it's very comprehensive healthcare. It's not just primary care anymore.
Interesting. And on the issue of mental health, we see a particular rise, I would just say, just to kind of give people some idea of what we're talking about, among colleges and universities where more and more students seem to need counseling services.
Yes.
Now, I don't know, Amanda, if you would agree that this is a uptick in numbers or if it's a greater awareness that it's okay to get help if you have these issues. How would you describe the increase in need?
So I think it might be a combination. I think that, you know, I'm going to do like pre-pandemic and post-pandemic. I think that the pandemic brought so many issues to light that maybe weren't being paid attention to before. And mental health was one of them. So it became part of the conversation. The stigma was reduced a little bit. So I think that people feel safer talking about it. They feel safer trying to address it through counseling or whatever. So I think it's a combination. I think it was there before. I think it's just become much more in the spotlight and also safer to talk about it.
And in general, you are going into more depth, it seems, in serving people who don't have insurance, where before you were more of a primary care and then referral source, I guess. Have those referral sources dried up, or are you just determining that it's better for the patient for you to provide some of those services without referral?
So our patients are they need a lot of hand-holding. So anytime we refer them out of here, first, we're doing a lot of work to get that referral. We have to find somebody who will see our patient. We make the appointment for them. We follow up to make sure they're going. We follow up to make sure they went because we don't want to spend our social capital. We don't want to tell somebody that a patient is coming and then not have them arrive. So we do an awful lot to facilitate that visit outside of the office. And then what kind of happened was we kept getting specialists who wanted to volunteer with us. Obviously nobody's doing like major surgery in here, but we do small lumps and bumps surgeries. So we wanted to take those volunteers and give them a place to volunteer. But it also makes it a lot easier for many things that can be done in this office to have it done here. We still have a whole network of specialists out in the community who will see our patients. Quite frankly, with the corporatization of medicine, so, it used to be that there were a lot of private practices in the community. Those private practices have almost all been bought up by hospital systems or other physician groups. So no longer are we calling Dr. Smith to say, can you see a patient? We're talking to a practice manager at that practice who very often isn't going to make the same decision that Dr. Smith made when he said to send the patient over. So some of it is just to make sure that we can get the care for the patients.
And I would think that given the high demand for healthcare workers, both physicians and paraprofessionals, that it's quite remarkable to me that you're able to get that many volunteers. What do you do to get them to agree to help people in the way that you do?
So, first of all, we're really lucky that we have, well, it complicates things, but we're really lucky to have 5 hospital partners here in the county. Um, Again, going back to the pandemic was so hard on healthcare workers that a lot of them left the profession. So we have kind of made a place for them. If they decide that they want to come here and volunteer, there's a place for them to do it. I think that what really appeals to medical professionals about volunteering here is that they can take all the time they need to get to know a patient, to get to know what their needs are. They don't have to bother with insurance, like, because we don't deal with any insurance at all. They're not getting late night calls. Like, it's just they can come here for 4 hours a couple of times a month. They can see patients. They can be the kind of doctor they imagine that they would be when they went to medical school. And I think that really, really appeals to people.
I can see that. So they can kind of work their own schedules as well, I guess.
Correct.
And so they might be doing something else now, and they say, on Saturday or in the evenings, I want to go see a few patients, and they can
Yes.
arrange their schedules to do that. And they can keep tabs on their own or their original profession. That's really brilliant, I think.
Yeah, we have a number of physicians who are completely retired. Actually, one of our diabetes specialists, she's 95.
Wow.
Sharp as a tack, and she's still volunteering with us. When she goes to Florida for the winter, she does telehealth visits with our diabetes patients. So we have a lot of people who are retired, and yes, they can keep their finger in the pot and continue to practice medicine kind of at their own pace. We have a lot of people who are semi-retired or thinking about retiring. So this is a way for them to kind of step down gradually. And then we also have a lot of people who are still fully employed, and they work it into their schedule when they can.
Wow. So administratively, this is still, I would imagine, somewhat of a challenge to schedule that many people who are just volunteering. All right. If you were paying them, you could say, well, I expect you to be here to get your pay, and the pay was an incentive. But how do you deal with people who say they're going to show up and don't? And is that a problem? Maybe it's not even a problem for you.
It's not really a problem. I mean, obviously, people have things come up and they may have to cancel every once in a while. But first of all, we have a great volunteer manager who, really, really describes what the volunteer opportunity is going to be like ahead of somebody signing on. There's actually quite a process that they go through in order to become a volunteer here, because we have to basically credential everyone just like a hospital would. So by the time they come here to volunteer, they're really invested. And we always do everything we can to accommodate their schedules. So I think that our volunteer manager and our operations manager have just a great working relationship with the volunteers. And I think the volunteers feel like they would be letting them down and the patients down if they don't follow through on what they're supposed to do. So that really is not a problem.
Well, that's a remarkable culture that you've been able to build. What about people who come to you and they have obviously concerns that go beyond what you're able to do? How do you manage that?
So as I mentioned, we have our 5 hospital partners here in Bergen County. We refer out to the hospitals. They do all of our diagnostics. So if somebody needs a colonoscopy or an MRI or whatever, they will go to the hospital. What we do to facilitate that is we make the appointment. We help them make the charity care appointment that they need to do before they can get the services. Again, we're reminding them that they've got this appointment. So we really work hard to get them there for whatever diagnostics they need. The reports come back here, and then we do whatever needs to be done post-diagnostic. We are able to get people surgeries. I mean, we have patients with cancer who have gotten surgeries, who have gotten treatment. So I think that we maintain a really good relationship with our hospital partners, and then we work really hard on this end to navigate the patient through the whole process. So and people frequently need something that we can't provide in here, and we spend an awful lot of time on that patient navigation piece.
Well, shout out to those hospitals that are willing to create a surgery opportunity for someone who
Yes,
doesn't have the money to pay it.
correct.
That's pretty unbelievable in today's environment. So,
I
whatever
will.
you're doing to, I don't know what arms you have to twist to make that happen, but
Well, most of the hospitals actually have representatives on our board of directors. So we have a hospital relations committee. So we work really hard to develop and cultivate those relationships with the hospitals because we couldn't do what we're doing without them. But quite frankly, we bring a huge benefit to them because we are keeping people out of their emergency rooms.
yeah. Well, there's that. There is that part of it. You're helping the hospitals in some ways, and that initial screening or work that you do to deal with people who don't really need to be in the hospital is
Yes,
definitely probably saving them lots of money because people do come to the emergency room without any resources, and the hospital has to find a way to cover it.
absolutely.
Let me ask you this. How are you funded? Is it just individuals? Are you able to get money from some of the larger institutions? Like I'm thinking insurance companies that maybe feel like they aren't able to insure people, but they'll give you some support at least to help people.
Yes, actually, we we certainly have support from individuals. That's probably, well, it changes every year, but that's a significant portion of our support. One of our biggest line items on our revenue is from foundations. Those would be corporate and some private foundations. And as you said, it's often people in the healthcare space because their mission is very similar to ours. So we do get grant funding. We get corporate support. We do a couple of like large events like our gala. And then we do get a grant from the state of New Jersey, from the Department of Health. We got that first one in 2020 because again we are we're part of the healthcare ecosystem in New Jersey, and it's a good investment for the state to make in a free clinic like this.
Yeah. Now, there are reasons why people don't have insurance because for some people, even when the rates go down, it's still not going down enough for them to actually afford insurance. There is also this insurance that we have, I guess it's called Medicaid. Are people at least eligible in your world to get that, or are these people who can't even get Medicaid?
So many of our patients are not eligible for Medicaid. You have to be in the country legally for 5 years in order to qualify for Medicaid or Medicare or Obamacare. So so that is one reason that they're not insured. Another reason that they're not insured is that they may qualify for subsidized health care. So through the exchange to get Obamacare. Um, so they can afford those premiums. What they can't afford is the copays. They can't afford the out of pocket expenses. For somebody with diabetes who needs to go to the doctor fairly often, every time they go, there's an out of pocket expense. So and our patients are really living on the edge. They can earn up to 250% of the federal poverty level. So for a single individual, that's around $37,000. Bergen County is a really expensive place to live. And, if they have to make the choice between putting food on their table, paying rent, buying school supplies for their children, and going to the doctor, they very often put their health care at the very bottom of the list.
Yeah, I can see that being a pretty strong case for support. How are you able to go about raising funds? You mentioned your gala coming up. What are you hoping to raise with your gala?
Well, my hope is that we will net 300 or $350,000. This year we have, so it depends on so many things: who's in the room, who your honoree is. In this case, our honoree is a wonderful man named Tom Dutch. He actually has been instrumental in helping us raise money for our expansion campaign, which we are going to be opening a second clinic in Garfield, New Jersey, sometime early next year. And Tom has really been the linchpin of that campaign. So we are honoring him. He's got a couple hundred of his friends and colleagues coming to the event. Again, we get great, hospital support. So people like to come out and celebrate success. And that's what we're going to do next Thursday.
Well, speaking of success, what are some of the success stories that you care to recount from people that you've actually helped?
Oh gosh. Okay, so one of the programs that we have a Korean healthcare program. Bergen County actually has the second highest concentration of Korean Americans in the country. And very often they are fairly recent immigrants, so they're not going to qualify for Medicaid. They also culturally need they need special health care. So we started a Korean healthcare program. Most of the time, many of them don't really speak any English. So we have interpreters, we have a Korean nurse practitioner, we've got a patient navigator. So we've got all these things in place to make sure that the patients in our Korean healthcare program get the help they need, and are comfortable asking for it. And we have a couple who are both patients here. The man he did a colon cancer test screening, and he needed to go get a colonoscopy. Well, it took a lot of resources on our part to get him the appointment, to get him to the appointment, it just took a whole lot of resources. Anyway, we got the test back. He's fine. But like, that's just kind of an illustration of how much effort we put into making sure that people get what they need. We have another patient. She has breast cancer in her family. She hadn't had a mammogram in years and years. We got her in here. We got her a mammogram. There was something suspicious on the mammogram, so we got one of the hospitals to do a biopsy. She's okay, but she needs to go back every 6 months. So what we want to do is catch stuff before it gets bad, and that happens a lot.
Mm. Amazed. I'm really impressed by all this.
It's a fun place to work because it's all it's hard work, but it makes such a difference in people's lives, and it's tangible. Like, you can see it. It's great. It's fun coming to work every day.
Well, it must be. You've been here 10 years, so that's not nothing. That's saying something about how committed and how much fun it must be to you to actually do this. You mentioned expansion. Obviously, we can't fulfill the complete need here with what you currently have, so you're expanding. Well, tell me more about the need. What do you estimate the need in your region to be for these kinds of free healthcare services?
So in Bergen County, there are about 40,000 people who could qualify for our services. So they're low income, and they are uninsured. So it's a pretty big pool of people. It's actually stayed fairly constant over the time that I've been here. When I took this job, somebody who is in the nonprofit sector said, "Amanda, what are you doing? Like, the Obamacare had just been instituted." And he's like, "What are you doing? You're going to be out of a job in a couple of years." Well, fortunately for me, that didn't happen, and there's still a huge need out there. So we are picking away at it, a patient at a time.
Yeah, well, the 40,000 people, and that's an overwhelming number. So you probably able to get to what, 1,000 or so a year? Is that what you're able to do right now?
Correct. We have right now just under 1,000 active patients, and we've seen about 900 over the course of this calendar year so far. Yes.
Wow. Yeah. So there's a big need. And it looks like I'm estimating somewhere around, what, $1,000 raised per patient or something like that? Or am I off on that?
You're under a little bit. It's about $2,600. Will provide
2,600.
a full year of comprehensive health care,
Okay.
mental health support, and case management services for one patient.
That's amazing. Still, I mean, when you think about it,
It
because
is.
I'm sure that other primary care facilities for profit would need a lot more in order to serve people in that to that degree. So you're not only effective, but you're efficient in how you go about this work, which is also really gratifying to see. What do you need from people? What do you need from everyday folk out there who might listen to this show and say, this is remarkable. I'm so glad I found out about a place that's really providing for people who don't have health care, which, as you say on your website, should be a right, not a privilege.
Mm.
What do you say to other people who might hear this and say, I want to help?
Well, I would say donate, volunteer, and spread the word. Those are the three things that we're looking for. We're still a relatively young organization. We're celebrating our 15th anniversary this year. And I run into people all the time who are like, Amanda, I've never heard of this. This is wonderful. So we definitely need people to spread the word. We need people to volunteer, and not only clinical people. I mean, of course, we need clinical people, but we have about 75 lay volunteers who do everything from, shredding to, some really interesting projects. And then we definitely need clinical volunteers. And then we need people to support us financially because we it, because we can't do it. No money, no mission. So
Do you get people from other communities coming to check out what you're doing to see how they might replicate it?
we have had a couple. There's actually a small free clinic in Fairfield, New Jersey, I think, called White Tulip. And they came to us when they were starting their clinic. Uh, BVMI is part. It was founded on a model called Volunteers in Medicine. There are about 92 other volunteers in medicine clinics around the country, including 3 others here in New Jersey. So we talk all the time. We mentor people, and we absolutely talk to people who first they're like, please come start a clinic where we are, which we can't really do that, but we absolutely share our expertise and are always happy to show people around.
Amanda, how did you get into this?
Um, in my old job, where I was for 18 years, so I'd stick around for a while, I was running or I started a civic leadership program for adults. And one of the speakers that we had come in to speak on Healthcare Day was the former CEO of Valley Hospital, which is one of our hospitals here. And he was also on the board of BVMI. And a couple months later, he called me up and he's like, Amanda, we're looking for an executive director for BVMI. Do you know anybody who might be interested, or maybe you're interested? And that started the conversation, and that's how I got here.
Wow, amazing. And here you are. Well, look, we're at the end here, but I just wanted to say how amazed I am with what you're doing. And to all our listeners, you've been listening to Amanda Missey, who is the CEO of the Bergen Volunteer Medical Initiative. And you've heard of all of the amazing things that they're doing to help people who don't have health insurance get the care that they need. It's quite remarkable. So we want to congratulate you and all of your staff and volunteers who are making this happen for people. And obviously, if you want to help, and you don't have to be local, you might just be moved by what you've heard here. You can help Amanda by going to their website, which is bvmi.org, and you can make a donation. You can find out how you can volunteer or in other ways help. And by the way, this is the Heart of Giving podcast. If you're listening for the first time, This is a weekly show, and you can subscribe to us on all major podcast platforms, and I hope you do. And if you're interested in the video version, you can join the BBB Wise Giving Alliance's YouTube page, and you can see all of the videos of our shows as they come out as well. So we hope we'll see you back here next week. Thanks for listening.
You've just listened to the Heart of Giving podcast with Art Taylor. Be sure to tune in next time for a brand new episode. To listen to our other interviews, visit heartgiving.podbean.com. That's heartgiving.podbean.com. Subscribe to our show on major podcast platforms. The thoughts and opinions expressed on this podcast are the views and opinions of the guests, not those of the BBB Wise Giving Alliance or program affiliates. This podcast is for information and educational purposes only and is copyrighted with all rights reserved. This podcast is protected by Podbean's terms of service.